Uh, Thank you for being with us today. If I can, I'd like to begin by at least recognizing the people who will speak initially. And you see that we are joined by probably half of the leadership in the state of California here today. And when we have Q&A, we'll have an opportunity to hear from some of our other leaders who are also joining us today for this very important announcement. I will say some words, and then I will turn the microphone over to our first partner of California, Jennifer Siebel-Newsom. She will then give her remarks and pass the mic over to Senate President Pro Tem Toni Atkins, who will then hand the microphone over to the chair of the Legislative Women's Caucus, Connie Leyva, who will then provide the Vice Chair of the Legislative Women's Caucus, Assemblymember Monique Limon, the opportunity to speak, who will then hand over the microphone to Julie Rabinovitz, who is the CEO of Essential Access Health, which is the principal provider of the services we're going to discuss today. And then she will hand the microphone over to Crystal Strait, who is the President and CEO of Planned Parenthood Affiliates of California. And they are among the most important of the providers of the healthcare services we're going to discuss today. Probably the best way for me to start out is by saying today's March 4th, 2019. The operative words there are 2019. This is not 1920. Yet, here we are, still fighting the same old battles for women's rights. We're standing here united today around a simple principle that we're going to say loud enough so that they can hear us all the way in Washington, D.C. All women should be able to access basic health services, including reproductive health care, no matter where they live. And medical care it's kind of basic that you have to say this, but you have to say it in 2019. Medical care should be between a woman and her doctor, not the president or the vice president of the United States. As the Trump-Pence administration continues to take aim at women's access to birth control and abortion care, California is standing with women across the nation, not just California, to protect their health and their rights. This latest battle in the Trump-Pence administration's war on women is an attack on the Title X program, our nation's premier family planning program, and the healthcare providers who care for women and our families. It's a safety net program that helps low-income women, many of them women of color, and it is a critical lifeline for nearly 4 million women nationwide. 1 million of them just in one state alone, in the state of California. This illegal Trump-Pence rule hits California families hardest of all. The Title X programs help women and families access preventative health care, such as cancer screenings, family planning services, including birth control, and much more. But the new Title X rule, something many of us call the gag rule, released by the White House last week, makes it harder, not easier, for women to access the care that they need. This rule gags our doctors, nurses, and other care providers from fully discussing reproductive health with their patients, and it bans doctors from referring patients for abortion. When doctors are gagged and women are denied care, it's dangerous not just for them, but for their families. Make no mistake, this is a systematic effort by this administration to end access to birth control and safe, legal abortion. The rule will interfere with the practice of medicine and will result in clinics going out of business due to financial strain. That's why today we are filing suit against the Trump administration yet again for this unlawful, harmful rule. We argue that the rule prevents doctors from giving patients full and accurate counseling about their reproductive health choices. We argue that the rule precludes doctors from fully informing patients as to their medical options. We argue that the rule forces Title X providers to forego federal Title X funding if they decide to provide full and accurate information to their patients. We argue that the rule requires family planning clinics like Planned Parenthood and community health centers to have physical and financial separation from abortion providers. In California, the costs of this rule would be staggering. For every dollar invested in publicly funded family planning programs, the government saves more than $7 in Medicaid-related costs. The potential gross public savings from preventing unintended pregnancies in California is estimated at more than $1.3 billion. And this rule would also make it harder for us to reduce health disparities that in the year 2019 should not even exist. According to the CDC, black mothers die at a rate of 3 to 4 times the rate of white mothers. It's one of the widest racial disparities in women's health. In California, we will defend those women and we will defend their families because they have a right to care anywhere and anytime it is threatened. We filed a comment letter last June and we filed a Freedom of Information Act request demanding justification for this rule. We filed requests with the Office of Management and Budget in Washington, D.C. to re-review this rule, and our record in California speaks for itself. We stopped the Trump-Pence administration from rolling back rules that aim to deny women birth control. We are continuing to defend the Affordable Care Act in federal court, and we're ready for this next challenge. We're ready to stand up for a woman's right to make her own health care decisions about her own body. I want to acknowledge Essential Access Health, which is also filing suit, and Planned Parenthood, which works every day to protect women's health. They have been with us defending Title X every step of the way. We won't stop fighting to protect every woman's right and every American's right to access quality, affordable health care. And now I'd like to turn to the first partner, Jennifer Siebel Newsom, for her remarks.
Good morning. I'm so glad to be standing shoulder to shoulder with our Attorney General, Senate Pro Tem, some incredible members of the state legislature, Planned Parenthood leaders and members of the media. So why are we here today? Because somehow in 2019, American women are still fighting for the right to determine the fate of their lives, our own bodies, and our own destinies. And the gag rule is only the latest example. President Trump has decided to attack a program that helps to ensure that every person has access to basic, preventive, and reproductive health care. This gag rule is an attack on women everywhere, but especially the most marginalized and most vulnerable among us. And let's be clear, this isn't about abortion. Title X funds cannot be used on abortion. No, this is about politics and pushing away organizations like Planned Parenthood. What the president is really attacking here is gender equality and female autonomy. Because organizations that provide reproductive services don't just protect the health of women, they enable us to control our own lives and to pursue our own dreams on our own terms. So in California, we will stand up for all women. We will continue to protect organizations that provide essential health services for women, and we will continue to support the values and the policies that recognize our full equality. Gav and I are proud to be living, working, and raising our 4 children in a state that is breaking down the barriers that hold women back. And I'm proud to be standing in a state that celebrates Planned Parenthood and community clinics. So in California, we will continue to work toward a world where men and women are truly equal and where all of our children can realize their full human potential. And we will make sure that the women of this nation know that California has your back. Thank you. And now we have the Senate Pro Tem, Toni Atkins.
Well, thank you so much, Jennifer, and good morning, everybody. You can say good morning even if you're a member of the press. It's okay. You know, I'm really proud and pleased to be here along with our Attorney General, the first partner, Jennifer Siebel Newsom, and an incredible array of women from the Senate and the Assembly, as well as some of our partners, along with Planned Parenthood and Essential Access Health. You know, in California, there are 356 health centers that receive federal funding under Title X, offering programs on a range of basic services that serve more than 1 million low-income and minority residents. These centers actually help prevent hundreds and thousands of unintended pregnancies. Without these efforts, we would see a dramatic increase in unintended births and abortions. And the point here, because there's already been the statement that Title X funds are not to be used for abortion services. But what this is about is really keeping women from getting access to information and basic care. Many of these women use the community clinic system and Planned Parenthood as their health homes, where they go to get basic health care related to birth control, related to overall health, and it's where they go to get referrals for services that they need. So we deserve not only unfettered access to care, but unfettered access to information. You know, as someone who actually was a director of clinic services for 3 clinics in California for a number of years, I can tell you story after story. I was in the room. I was counseling and working with women who came for services. And you know what? Women hold a unique place in the world and in society. An added responsibility we have when it comes to the decisions of family planning, of how to take care of our families, whether to even choose to take a pregnancy forward or to make the painful decision not to. And if you think we're not fully aware of that responsibility that we hold to protect our families, ourselves, to have the ability to control our own lives, we don't deny, we don't walk away, we don't get to ignore that responsibility, ever, ever. So let me be clear. With my partners behind me in the state of California, we will stand strong. We will stand strong and work with these community clinics and with Planned Parenthood on a strategy that responds to this challenge and preserves our access to care. And I'm proud to be in California. But you know what? I have talked to women all across this country, and I am very concerned, not just for Californians, but for every woman who has to make that decision, who has to get access to information in a non-judgmental, fair organization that will provide all of the options. And so the decision to do this and to not be able to refer patients for services that they need is really immoral at best. And so I stand with my colleagues today. I applaud the Attorney General for representing California so well, and my colleagues here behind me. And now I have the opportunity and the pleasure to introduce the chair of our Women's Caucus, Senator Connie Leyva.
Thank you, Madam Pro Tem. Good morning. As the chair of the Women's Caucus, I would like to introduce the women warriors standing behind me. Senator Rubio, Senator Jackson, Senator Durazo, Senator Mitchell, Senator Hurtado, Senator Skinner, Assembly members Petrie Norris, Smith, Quirk Silva, Sharon, Rivas, Bauer-Cahan, Reyes, Weber, Rubio, Friedman, the Vice Chair, who you will hear from, Limon, Wicks, Gonzalez, Boner-Harworth, Caballero, Kamlager-Dove, and Aguiar-Curry. These are the women warriors who are going to continue to move California forward. As you have heard, this reducing Title X puts a gag rule on a doctor's mouth. Can you imagine, as a woman, you are pregnant and you want to find out what all of your options are, and your doctor cannot even talk to you about it? It is truly shocking. And as the Attorney General said, it's 2019 and we're still worrying about this. And this is about fully integrating women into society and making sure that we are paid equally to men, that we can decide what we're going to do with our bodies, when we're going to incorporate a family, and with whom we're going to incorporate a family into our lives. You will also notice that we are all wearing little hangers. These represent a callback to, or harken back to, a time when abortion was illegal. Making it harder for a woman to get an abortion doesn't mean it won't happen. It just means more women are going to die. And I don't know about all of you, but it's high time we respect women and we respect our place in the world, we respect our choice to make our decision over our own bodies. I thank you all for being here, and I thank these amazing women that join me and our enlightened men. And we're going to tell the White House we're tired of two old white guys telling us what we can do with our bodies. With that, it is my pleasure to introduce the Vice Chair of the Women's Caucus, Assemblymember Monique Limon.
Thank you. Thank you all for being here. Today we're gathered, and we do so in a very united fashion, ensuring that we are here to make sure that the state of California knows that healthcare choices in this state will be protected. And they will be made by women coming together with their medical doctors. We do not believe in limiting a patient's right to get all the information they need to make the right decisions. This is simply unacceptable. And as we discuss what it means to understand these options before you, as you hear from providers and from women, we need you to make sure that the state of California understands that all information needs to be given to patients and decisions are up to the patient. And we are here to ensure that patients also understand what's important for them in the languages that they need it. Hola, soy Monique Limon, asambleísta, y aquí estoy representada con grupo de líderes en el estado de California y nuestro fiscal general del estado para asegurar a todos los pacientes, especialmente las mujeres en el estado de California, que estamos aquí apoyando a las mujeres para asegurar que reciban toda información médica que necesitan para hacer la decisión médica que es mejor para ellas. El gobierno federal otra vez ha decidido promover una propuesta que limita la información que les damos a las mujeres. Esto no es solo sobre el aborto. Esto es sobre la información, y estos límites en los doctores y doctoras del estado de California traen problemas para la comunidad porque no dejan que los doctores, los profesionales médicos en este estado den toda la información. Así que queremos que sepan que aquí como estado de California, como mujeres, como líderes en este estado, estamos apoyando a cada mujer. Y estas clínicas seguirán abiertas en este estado. Seguiremos dando información y seguiremos dando servicios para todas mujeres en este estado. Gracias.
Good morning. My name is Julie Rabinovitz, and I am the President and CEO of Essential Access Health. I want to thank Attorney General Becerra and our incredible champions in office for taking action on this critical issue and for once again standing strong to defend California's values. Essential Access Health is unwavering in our commitment to ensuring access to quality care for the 1 million women, men, and teens who rely on the Title X program every year. That's why today we are joining Attorney General Becerra and the state of California to mount a robust and vigorous legal challenge in federal court to block the Trump-Pence administration's unlawful Title X regulations from taking effect. Going to court is something that we do not take lightly. This is the first time in our organization's 50-year history that we have ever filed a lawsuit. The regulations published today in the Federal Register represent some of the most extreme policy changes in the history of the program. The regulations conflict with clinical best practices, violate medical ethics and current law, and threaten decades of public health advancements. The Title X Federal Family Planning Program has been a critical part of our public health system since it was established by Congress with bipartisan support and signed into law by Republican President Richard Nixon in 1970. Today, California is home to the largest, most comprehensive provider network in the nation. Title X funding supports the delivery of quality family planning services like birth control, STD testing and treatment, cancer screenings, and other essential services at over 360 clinic sites in 38 of California's 58 counties. If implemented, these regulations will delay access to essential reproductive health care for patients statewide, particularly in rural areas and in communities of color. The regulations will devastate California's Title X provider network, forcing qualified providers out of the program. Although the regulations are designed to target health centers that provide abortions, they will also negatively impact clinics such as community health centers, urban Indian health centers, hospitals, universities, city and county health departments, as well as school-based clinics. Most significantly, the regulations deny patients the quality care that they rely on through the Title X program. This is absolutely unacceptable. As the leader of the largest and most diverse Title X network in the country, serving more than 25% of all Title X patients nationwide, Essential Access has an obligation to protect Title X's mandate to make comprehensive family planning services available to all. We cannot and will not allow the Trump-Pence administration to create a two-tiered health system that dictates a different, lower standard of care for low-income and uninsured individuals. This is not only wrong and harmful, it is unethical, unlawful, and unconstitutional. So today, Essential Access is taking the Trump-Pence administration to court to ensure that the regulations never take effect. I'd like to thank our team at Kecker, Van Nest, and Peters for filing this lawsuit on our behalf this morning, and the team is represented here today by Sophie Hood over there, who will be available to take questions. Thank you all for being here. And now you'll hear from Crystal Strait, who is the president and CEO of Planned Parenthood Affiliates of California. Planned Parenthood Affiliates of California have about 100 Title X clinics out of the 360 Title X clinics in the state of California.
Thank you, Julie. Again, my name is Crystal Strait. I'm president and CEO of Planned Parenthood Affiliates of California. Planned Parenthood strongly supports Attorney General Becerra and the lawsuit he's filing today on behalf of the state of California. We, of course, appreciate the support of Attorney General Becerra, our first partner, Jennifer Siebel Newsom, our pro tem from the Senate, Tony Atkins, the chair of the Assembly Select Committee on Reproductive Health, Rebecca Barrett-Cahan, our, of course, Legislative Women's Caucus leadership, Senator Connie Leyva and Assemblywoman Monique Limon, and, of course, the group you just heard from, our Title X grantor, Essential Access Health. This gag rule hurts the very women and families that need help the most, those that have the most barriers to care and face staggering maternal health issues, including death. And yet these are the very women Donald Trump is targeting as he dismantles the nation's only program dedicated to reproductive health. Women like Novelyn in Los Angeles, who used Title X to receive screenings from Planned Parenthood to find her breast cancer when she had no other insurance. You've already heard the details about the lawsuit, so let me be very clear. Reproductive health care is health care. And let's be extremely clear about what this gag rule is really about. It's about stigmatizing abortion. It's about demonizing women. It's about shutting the door on science-based sex education. It's about building a wall between a doctor and her patients. It's about the 2,000 Planned Parenthood medical professionals in the state and the gag Donald Trump is shoving down their throats. How dare you, President Trump? Women are dying. We will not be silent. Our doors are open. Our mouths are open. Our hearts are open. Planned Parenthood provides care in California to anyone who needs it every day. That's what we do, and that's what we will continue to do no matter what. And now I'll bring up our champion. Again, we are so grateful to have Attorney General Becerra and all these leadership, all these women and leaders behind us, but we cannot tell you enough the difference it is in California for Planned Parenthood when you have an Attorney General who is the chief defender and you have a governor and first partner like the Newsom. So thank you.